Today my committee and I will be going over how to apply for Medi-Cal. My name is Tameen. I am the RFC Social Services Officer for the 2020-2021 school year. I am a fourth-year biochemistry major at UCR, and after college I plan on pursuing a career in medicine.
Hi, my name is Anna Tran. I am one of the Social Services Committee members. I am currently a third year as a psych major at UCR. I hope to pursue a master's in social working so I can be a social worker for the hospitals. And a fun fact about me is that I really enjoy cooking.
Hello everyone, my name is Safi and I am a committee member for social services as well. I am a fourth year biology major studying at UCR. And a fun fact about me is that I've been making myself vegan breakfast for the past few months. And it's a really nice, healthy habit that I really enjoy starting my morning with. So today we'll be going over what Medi-Cal is and how we may be able to apply for it. So starting off, what is Medi-Cal? Medi-Cal is a program that offers free or low-cost health coverage for children and adults with limited income and resources in California. And so that includes families with children, seniors age 65 plus, persons with disabilities, persons within the foster care system, and pregnant women. And as shown from a chart directly taken from the Department of Healthcare Services in California, Medi-Cal covers a large portion of California residents, which is around 12 million people as of March 2020. So what are some of the different ways that one can apply for Medi-Cal? There are 4 different ways to apply for Medi-Cal, and to explain this thoroughly, I will go ahead and share my screen. So if we Google apply to Medi-Cal, this website right over here will usually appear as one of the first few, and so if we click on it, we see that there are multiple ways to apply for Medi-Cal, and that includes applying by mail, applying in person, and applying online. And although it doesn't mention it, we can also apply through phone. And so for applying in person, one has to go to your own county social services office. And over there, you'll be provided with in-person assistance with the entire application. And we can find our specific social services office using this website right over here. And so if I click on it, and then if I click on the county listings between M and R, we see that there are multiple counties listed and their addresses for the departments of social services. And so if I scroll down all the way to the bottom, we see there's Riverside County's Department of Public Social Services. However, there isn't a specific address mentioned here for Riverside County, and that's because there are multiple locations for applying to Medi-Cal within the county. And we can find those locations by clicking on the website right over here, and then clicking on office locations. And this is the County Riverside Department of Public Social Services website. And so if we scroll down, scroll a little bit to the right, we see that there are multiple locations depending on where one lives in the county for applying to Medi-Cal. And so if I live in Riverside, here would be the 2 closest locations for me to go to if I wanted to apply to Medi-Cal in person. So that's how one would apply to Medi-Cal in person. So now moving on to applying through mail, we can find the single streamlined application in the original website that I clicked on right over here. And so if I click on this link, we see that there are multiple applications to choose from depending on what language we speak. And so Anna will go into the details of what is inside the application, which is why I'm not going to click on it. But what's important for us to know right now is that for mailing, we would fill out the application, print it out, sign it, and then mail it either to Covered California's address right over here, or we would mail it to our local social services office. And we know how to find that office based off of how I showed how to do that through applying to Medi-Cal in person. And so that's how to apply to Medi-Cal through mail. For applying through phone, all we have to do is call our local social services office and then follow the steps the operator or the personal assistant provides. And so I showed how to find the Riverside County Social Services office when I was showing how to apply to Medi-Cal in person. Real quick, I will show how to do so again, except with San Bernardino County. So if I click this link right over here, and then instead of clicking the county listings from M through R, I would click on the county listings S through Z. And right over here is San Bernardino County. And again, they don't have a specific address for their department because they have multiple locations within the county. And so I would click on their website. I would hover around where it says resources and then click on find an office. And so now all I have to do is input either my zip code or the city where I live in. And so for the sake of an example, I will input this zip code in San Bernardino City. And so when I press enter, this is the designated office and fax number and hours of operation, which I can refer to. So now moving on to applying online. And so if I go back to the original link that I was on, we see here that the Covered California website is provided. And so if I click on that, there is an option to apply online. And so if I click on that and then click on apply online, there are a few instructions over here on how applying online works. And it shows that it takes about 30 minutes from start to finish, and the documents that are required, which is the social security number, immigration documents, employer and income information, and federal tax information. So if I click on apply now, all I have to do is create an account and just upload all of this information, and then I would be able to press next and move on to applying. And Anna will go over the details on what's included in the application process from here. It is also important to keep in mind that after we fill out a form with all of our information and submit the application, we would wait for a personal assistant to call us and go over our application with us. And it says on the website that if you fill out the application during business hours, which is between 9 a.m. and 5 p.m. on weekdays, we should receive a call within 20 minutes.
Thank you, Safi, for showing us all the different ways to apply. But before we do apply and do the application process online, we first have to see if you're eligible for the program. Who is eligible to apply? First and foremost, for eligibility for Medi-Cal, the biggest thing is that it's based primarily on one's income. You have to be defined as below 138% of the federal poverty level. If you search on Google for federal poverty level, it will show you all the different graphs or the calculations, but those are rough estimates. So even if you feel like you might not be correctly below on 138%, you should still try to apply because there are many scenarios that there is a chance you can still get it based on the other possible eligibilities. Second is if you're the age of 65 or older, you also have a chance. This is not a guarantee, but it does take into account for the Medi-Cal process. One of the third ways that you could possibly be eligible is if you have a disability. If you're aged or disabled, you may be eligible for an age disabled program. And if you're disabled and working, you may be eligible for California's Working Disabled Program. You will have to pay a small premium for Medi-Cal coverage, but you can have accountable income up to 250% of the federal poverty level. For number 4, if you're in the foster care system, you have a high chance of getting approved for Medi-Cal. Number 5, if you're pregnant, you have a chance of getting approved for Medi-Cal. This is not a guarantee, but it is a factor. It's important that maybe there is a chance you've applied before you were pregnant and you got declined, but if you are pregnant, there is a possible better chance of getting approved. So if this is your scenario, I would suggest that you still try to apply again. And number 6, if you're part of any of these aid programs, which is CalFresh, CalWorks, Refugee Assistance, or Adoption Assistance Program, you also have a high chance of getting approved. So we really suggest that you do try to apply, as the process is pretty simple from the application process that we've already shown. And if your income is too high but you're disabled, aged, or blind, you can be qualified for a payment called share of costs. Now I will be showing you what it looks like to apply for Medi-Cal online. So going off of what Safi said earlier about going to that application on Covered California, you're going to be clicking on apply now, and then when you go, it's going to say log in or create an account. I had an account already, so I logged in, and it's going to look like this, and you're going to just click this begin application process and apply now. And there are further There are further application questions that it will ask you. I'm unable to show it to you just because I would have to be submitting it from mine. So it's pretty self-explanatory. You're just gonna follow those steps. But if you rather have someone that can help you on the call, we have this other website called The Covered, California.helpondemand.com. You just search that up, and then this link will pop up. And then it's gonna say a certified enroller will contact you within 20 minutes or less. And it's pretty self-explanatory. You're just gonna fill out these, and you're gonna do your first name, your last name, your cell phone number, preferred for your contact. So you do cell phone, email, phone, then you punch in, and then email, zip code, city, which language, and then it's gonna say if you and your family members are currently enrolled in a health insurance program. And would you like to participate in a follow-up survey? Yes or no. Submit, and then the enroller will either call you, text you, or email you based on which choice that you picked to be contacted by. There's a higher demand right now due to COVID, so please be patient with the enrollers. They will contact you as soon as possible, so just make sure, like I said before, that within this time that you are setting a time aside to have that waiting period, just waiting for the enroller to call you back. And make sure that it's in normal business hours from 9 a.m. to 5 p.m. And on the weekends, holidays, and after normal business hours, contact times are subject to the availability of the certified enrollers. And that's basically how you will apply online.
I've been approved. Now how do I go about choosing a plan? Number 1, your county will mail you a notice of action, or an NOA. After filling out this application, your county will mail you a notice stating whether or not you qualify for Medi-Cal within 45 days. Number 2, you would receive a benefits identification card in the mail. If you have been approved for Medi-Cal, then you will receive a benefits identification card, or BIC, in the mail along with the packet. Number 3, covered under fee for service. When you first qualify for Medi-Cal, you are still covered under fee for service until you choose a specific plan. This means that you have to pay for each service performed. Number 4, you would receive a list of healthcare plan options. So along with your BIC, you should receive an informational packet containing the available healthcare plan options in your county and how to apply for them. Number 5, you would review your plan options. If you've received multiple options, please go ahead and review each option to see which one best fits your needs or that of your family. Number 6, a plan must be chosen within 30 days of receiving the packet. It is important that you choose a health plan within 30 days of receiving the packet. If no plan is chosen within the 30 days, then Medi-Cal will automatically choose a plan for you. What are the benefits that I can use? The 10 Essential Health Benefits, or EHBs. The Affordable Care Act ensures that all the Medi-Cal health plan benefits you receive include the 10 essential health benefits, which I will go over in the next slide. Number 1 on the list of essential health benefits are outpatient services. These are medical procedures, tests, and services that can be provided to a patient without an overnight hospital stay. Number 2, emergency services. If you are having an emergency and visit an out-of-network hospital, then insurance companies cannot charge you extra for this care. Number 3, hospitalization. Examples of hospitalization include surgery and overnight stays. Number 4, maternity and newborn care. These are services provided to you before and after your child is born. Number 5, mental health and substance use disorder services. Examples of these include behavioral health treatments such as psychotherapy and counseling, mental and behavioral health inpatient services, and substance use disorder treatment. Number 6, prescription drugs, and number 7, lab services. These consist of medication or any tests that your physician orders for you in the course of care. Number 8, physical and occupational therapy programs. These are services and devices to help people with injuries, disabilities, or chronic conditions gain or recover mental and physical skills. Number 9, preventative and wellness services. Some common examples of these services include vaccinations and screening tests. And lastly, number 10, pediatric services. So these consist of almost any service that adults could obtain, but for children. This includes oral and vision care as well. If you have any additional questions, please reach out to rfc.socialservices@gmail.com.